Hello everyone, welcome back. This is Sister Nonhlanhla, your midwife. And today we are talking Caesarean section birth. With multiple conversations that I've had with different ladies from different races, some have really voiced out, heartfelt stories of how everything happened, and some felt very cheated. What I want to say is there's multiple reasons why we end up with Caesar. As a lady that has also had C-section herself, I must say, initially it felt like, I failed. But the one thing that I took away was I was a stronger woman than I was before, because being cut and experiencing that pain for 6 weeks was no joke. So ladies, there's of course different indications why we end up with C-section as ladies, and some of those indications are both maternal and fetal. So when we are talking maternal indications, now we are talking mommy issues. And with this one, I'm going to highlight about a few to just get you to know why we end up with C-section. So those ladies that have what we call pregnancy-induced hypertension, which may end up being preeclampsia in pregnancy, will end up with a C-section a lot of times because of what they go through, and also the fact that they might end up fitting during the natural labor process. So we need a controlled environment so that both mom and baby can be saved. Instances where mom has diabetes as well, those babies are either very big or they are very small. So we call those macrosomic or microsomic babies, and a lot of times, because those babies will not be able to maintain their sugars and all of that, your doctor would advocate for you to have a C-section. Another indication would be cephalopelvic disproportion, where now we see where the pelvis of the mom is either too small to accommodate the baby, or it has a narrow ending, because we all have different types of pelvises. When some people have a gynecoid type of a pelvis, some have an android, which is more your male type of pelvis, and that can lead to one having a C-section. The other thing would be where mom has also other conditions like heart condition or anything that is medical that would interfere with the whole laboring process, then your doctor would advocate for a C-section. Of course, there's also assessments that are done to make sure, which is like your Bishop's score, that is done by your doctor or your midwife to say, is this pelvis adequate for the baby to be able to maneuver it and be able to come? When we look at fetal indications as well, we're looking cephalopelvic disproportion again, and like I said, with the Bishop scoring, we would be able to tell if mom will be adequate enough for baby to come or not. And that would account for a Caesar in instances where it is not happening. Fetal distress is one of the other indications that end up, that lends us having C-section, and that would be where your baby gets tired from the whole laboring process, either also being a cord being around the neck of the baby, and that leading to fetal distress. Therefore, mom will end up with C-section. Another indication would be where the placenta is lying low. So when the placenta is lying low, or what we call placenta previa, where it's also covering the mouth of the cervix, which is the mouth of the uterus, which is the cervix, then you end up with C-section, because for baby to come, it means the placenta will be delivered first. And remember, the placenta is the lifeline of the baby. So we need that intact until baby is completely out, then the placenta can be delivered. In instances where mom has what we call placental abruption. This is where now you find that the placenta detaches from the wall of the uterus, causing bleeding. So for anybody that has what we call APH, which is antepartum hemorrhage, your doctor would monitor you very closely as well to check if it is not placenta abruption, where the placenta is detaching and bleeding is occurring. As I said, the placenta is the lifeline of the baby, so we need that intact at all times for baby to be born, and the placenta can be delivered afterwards. So those are some of the few reasons why we end up with C-section. Of course, there's the timeline in terms of when one comes to the hospital as to what happens when you get to the hospital. A lot of times when you get to the hospital, there's a lot of paperwork. Of course, you would have prepared, and probably if you are lucky and it's not an emergency, you would have chosen a date together with your doctor. And remember, ladies, for those ladies that have had previous C-sections, your doctor would also encourage you to have a C-section second time around. But there is what we call vaginal birth after C-section, so you can still have a vaginal birth post C-section depending on what's happening with your second or third pregnancy. So you'd have to have proper assessments with your doctor or midwife for that direction to be taken, and you can have your vaginal birth post C-section. Of course, like I was saying, there's timelines in terms of when you come into hospital and what happens once you are now in hospital. So what happens is that you'll need to come in a lot of times 2 to 3 hours before your scheduled time for Caesar. This is so that everything that needs to happen in hospital in terms of preparation can be done. Your baby will be monitored, your vitals will be done, you know, there's paperwork that needs to be completed prior the whole procedure to be done. Remember also, not all doctors are in hospital at all times, like your anesthetist. They could be busy with another case or anything like that. Therefore, the theater team has to be organized in time for that to take place. Post C-section, of course, immediately after your baby is done, I know we worry about things like delayed cord clamping and skin to skin with your baby. Those get to be done as well. The delayed cord clamping still happens in the labor theater, depending on whether was this an emergency C-section or a scheduled C-section. For a scheduled C-section, of course, we can do delayed cord clamping. But in instances where it's an emergency Caesar and your baby comes out flat or non-responsive, then it means the doctor would clamp and cut as quick as possible so that the pediatrician can take over resuscitating the baby. All right. And then we're talking now, once baby is okay and mom goes back to the ward with the baby, skin to skin is done, and we talk about the golden hour where you initiate breastfeeding as well, and skin to skin is maintained, and you keep your baby on you for as long as you want, and you are helped in the ward as much as possible in terms of what needs to happen. And ladies, that's that regarding C-section. And remember to make sure that when you get home, you keep your wound dry, you do not lift heavy things, so you take it easy, and the recovery period is about 6 to 8 weeks, depending on how quick you respond. Thank you, ladies. Adios.